Thank you. I'm really honored to be here to be able to share the history with you. When you came, Ted called me historian, and that sounded very old. So the history of pediatric palliative care in Minnesota really takes a village. And when you look at this, then you'll see lots of people that you recognize, some very famous and some not so famous. And I'll be speaking of the history. There's people we'll call Welso, Betty Cohen, and even President Obama, who was able to pass the Accountable Care Act, which made a huge difference to pediatric palliative care. Ida Martinson was a researcher in University of Minnesota, and she spoke to her neighbor, doctor, who said, I'm really upset. I have to admit this kid to hospital, and he doesn't want to come in. And she said, well, wouldn't it be better for him to die at home? They said, yeah, that would be great. She said, do you need to do a research study on that? And so Ida said, oh, sure, let me do a research study. I'll think about it through the IRD. The next day, the doctor called her and said, great. I told the parents that you would be willing to take this child home on Saturday. And she's like, oh, my goodness. And so she made it work. So you'll notice one of the pictures that was on the first slide was, this is fine. The little engine that could. How many of you know that story, the little engine that could? Some of you, not all of you. Okay, so it was a little engine that was quietly sitting in the background away from all the famous big engines, and the train carrying lots of toys to the children across the mountains. And the thing is, we're like, that's not important. But this train broke down, and so all the toys and everyone was very upset that they couldn't get to see the children. All the big engines said, this is too frivolous for us. We're not going to take care of this. And so the little engine that could said, well, I can try. And so it pushed, and he said, I think I can. And that's what reminds me of pediatric palliative care here in Minnesota. Really small beginnings. Ida Martinson, who started that. And Becky Bedore, he's now sort of the mother of skill jumping, of pediatric hospice. She was Ida Martinson's research assistant, and she was working in children's hospital. She thought, these kids need to stay at home. Maybe we could do a home care program. And so she had Lottie's as a phoneologist, and they're not taking care of any of my patients, not over my dead body. But she did it. I can. And it was the nurse-led hospice program that started at Children's. But as you all know, hospice takes a team. And so she thought, well, we really need more than just nurses for this program. So she hired a social worker, Stacey Ranke. She was the first pediatric hospice social worker she joined, to really address the unique needs of children and their family. During that year, Minnesota granted the hospice license to children's hospitals and clinics. It was the only hospice point care in Minnesota. Then a group of us thought, we really need a pediatric rested and hospice center. And so Deva House was started with 3 founding members. We worked really hard now every 2 weeks to develop a freestanding hospice. Money was raised, $7 million. A house was purchased on Summit, perhaps not the best choice of house for the kids running land in an old mansion. But unfortunately, no children were served, but there were lessons learned. Collaboration across settings is essential, and the right people at the right time is essential. The money that was raised from selling that house was given to a number of the palliative care programs to Avenel and Kishes, very helpful. But it wasn't just the children's pediatric palliative care that developed. At the University of Minnesota, Julie Howard started their pediatric palliative program. If you don't know Julie Howard, she is probably the leading pediatric palliative care neurologist in the U.S. and cracks the world. This is a wonderful person. She has a great book out. If you don't have it, please have a look at that, called The Blessings with Grace or something like that. Fantastic. Then Dr. Naomi Golub came, Jody Dobb, nurse practitioner, kept everything going, called it the changes, and now, of course, Dr. Bond. And probably talking more about the resources of our bear. Now I'm just giving a background history. Meanwhile, palliative care continued to develop. In 1999, I joined Children's Hospice, and Children's Hospice became a hospice center, I think. So I didn't want to miss Gillette. Gillette's Palliative Care was started by Dr. Julie Howard in 2000s. At first, they didn't have a team, and they would ask us from Children's to come and help them with their end-of-life issues. And so we would come, but then they realized they could develop their own team, and Dr. Julie Power developed the team in hospice, and Dr. Schwantes and Dr. Dauber, and they have a large team. Mayo also developed theirs a bit later. It's called Compass Hair. 2011 is started by Dr. Brenda Schultz. And now they've grown to have an RN coordinator and a full bereavement team, as well as a full complement of nurse practitioners, chaplains, social workers, and more. So that's what was happening in Minnesota. But what happened nationally really had a huge effect. Prior to this, to the medicine report, people said, "Oh, pediatric palliative care, there isn't the need. There's not that many kids that need it." And it was being done by a very exclusive group of people who wouldn't allow others to come. And so the people who were publishing were not the people who were doing the work. A lot of people doing the work, but it just awareness wasn't there. The people said, "No, there's no funds. No one's going to give money for diamond children." The Institute of Medicine report came out in 2003, and there was a panic because the report said there is a need, and all these children are at home, and they're not getting the care that we need, and what's the nation going to do about it? And so there was a panic in D.C., like, what are we going to do? We have to do something. And after the panic came the perfect storm. The NHPCO, so that's the National Hospice and Palliative Care Organization, hired a private consultant to investigate and see what are we doing across the country. At the same time, our famous Jesse Ventura, governor, had a statewide survey in Minnesota to survey what do we need, what are the hospice needs, all of them. And 6 of them came out. The one I'm going to talk about, of course, is the need for pediatric palliative care, education, and support. So the consultant called Minnesota and talked to Ellie Hans, who was the head of the Minnesota Hospice Organization at the time. And they said, "What are you doing for Children's?" And she said, "I don't know, you have to talk to Children's." At that point, we were doing outreach and education. And so the consultant called and was very interested, and we were invited to apply for federal appropriations. We were a small group, and I said, "Federal appropriations? Oh, okay, well, that doesn't mean, right?" But our co-applicants that they suggested declined. So Stacy and Jody went to Washington, a bit like 2 country bumpkins one year, like, what are we going to do? The legislators and how to dress. And NHPCO took us into the office and into the green room, got us all prepped, and then we went and saw every legislator. And at that point, every legislator, both in the House and the Senate, was Democratic, and they were supportive of this. What was so interesting is when we went to talk to them, they were like, "Really? We never heard that this would even a need." Nobody knew about it. So as those of you who worked in legislation, the first couple of years it'd be about raising awareness. People didn't know about it. They hadn't heard anything about it. So we applied for federal appropriations. We applied for a lump sum of money for pediatric palliative care. We were going to do a test pilot in the upper Midwest, so North Dakota, South Dakota, Wisconsin, Iowa, and Minnesota. And then the Iraq War happened. And it's like, okay, yeah, there goes the money. Nothing's going to happen here. But, inshallah, we got $250,000. And CIPSI. So CIPSI was Children's Institute of Palliative Care, was formed And our focus was to provide education for those states that was mentioned in the upper Midwest, so then it could be replicated in other places. Out of this came the Pediatric Palliative Care Coalition of Minnesota, which is still here today, and Dr. Lunderman will be talking with you about that, and that's the coalition to really look at advocacy and education in Minnesota. Dr. Stefan Friedrichsborg joined from Germany, and was an integral part of pediatric palliative care growth in Minnesota. So we developed the ALEA seminars. So these were seminars that brought people to come to Minnesota. So we made our way in that, all the nurses and educators from the countries that we were looking at. And we brought all these famous people, Joanne Wolf and Stephen Liebman, and all these really famous people because they had money to provide for them. So these were the people that were doing the work, but they weren't the ones that were able to publish and speak as much as we'd hoped. So we were very excited about that. We have brochures and postcards and very enthusiastic. And when you're really enthusiastic about a program, you think everybody's going to be enthusiastic about the program. So we had this rate set up. We had the conference hall booked, and we invited all these famous national speakers, and nobody came. We didn't have any registration. We wanted 50 people, and it's like, oh my gosh, what are we going to do? And so it's like, okay, we better start calling these hospices. We had emailed to all the hospices in the area. And so when you're now, we have to ask. I remember calling one hospice and saying, so, did you get that postcard? And they said, oh yeah, I think it's somewhere here. Maybe I threw it away. Oh, great. I said, so tell me, what do you do when you have dying kids in your county? She said, I don't think kids die in the county. I want to go live in that county because that's not like a lot of it. But we did eventually reach our goal of 50 people. They're really. So we had a free conference to collaborate and educate and help people understand. At the same time, the Robert Wood Johnson Executive Nurse Fellowship. So this was a funded fellowship, and the project was to continue that pediatric palliative care education, and this was centered in Minnesota. 3 sites of Rochester, Alexandria, and Duluth. At the same time, we looked at legislation for pediatric palliative care provision. So as you know, legislation takes a long time. And again, our legislators in Minnesota, I remember speaking to one legislator. She must have been very tired because public speaking, she was just lying back in her chair out there, super exposed. And then when I told her of the problem, she sat up and she said, I didn't know anything about this. Raising awareness was so important. So we have been working with Minnesota DHS for some time. They really felt like there wasn't a need for pediatric palliative care support because there were waivers, and they really didn't want to move on that. So we did start some legislation, which we'll talk about in a minute, but the legislation really put pressure on the DHS to complete the study. In 2008, the Compassionate Care Act for Children was started. The goal was really to establish a palliative care benefit for children. We know that there's a hospice benefit, and now with concurrent care, kids can have the hospice benefit along with aggressive curative therapies. And the hospice benefit, for those of you who aren't so familiar with it, it has kind of 4 stages where you get a per diem for home care, you get per diem for inpatient and respite, and extended hours. And for palliative care, because the kids' needs vary so much, those of you who work in it see that. For those of you who maybe do adult hospice, it's more like a COPD or a CHF, where people get very sick, kids can get very sick, and then get stable and very sick. So you want a benefit that is flexible with the child's needs. And when this act came up in the legislation, we were trying to move it through, and then DHS said, okay, we'll do this thing, just don't legislate us. So we had meetings, and they found that there was a real need for palliative care in the whole state of Minnesota. And I don't want to forget, of course, the hospice house for children. Cage Linden Sprouts in 2009 set that vision for freestanding pediatric hospice. Those of you who haven't looked at the website, it's a fantastic website, and I'd love to just read the whole story. We don't have time, but do have a look at that. That campaign for funding and buying the building, a lot of you were involved in that. And then Catherine Kinney, Director of Nursing and Operations, really brought it to fruition. The first patient came, and now it's in full swing, as you well know. So each of these steps was so amazing. And what was, if I can just shout out to Katie, it's very common for these hospices, freestanding hospices, to stall a number. It's tried to start off here in Minnesota, as you saw from Deva House. And one of the big mistakes that people make in nonprofits is that they don't have the right people at the right time. So often the person who has a vision is not able to step back and let the professional take over. And Katie, you did that, and were able to do that, and just amazing that for that, as well as the amazing work Judd. But it's so exciting. A lot of blood, sweat, and tears. As we move along in Minnesota, the Palliative Care Advisory Council, and PCAC, was created in 2017 by Minnesota legislators. So you see the palliative care, including pediatric palliative care, the awareness is raising. And it's only with the raising of awareness that we can bring changes across the nation. So this is an 18-member interdisciplinary team, and it's 2 pediatric members. And it was directed to assess the access to palliative care, the barriers, and what legislation was needed. So the committee is really looking now, can we do a palliative care benefit that includes pediatric across the board? So some states have done it, California, Hawaii, they have a pediatric palliative care benefit. But when you look at the different states, how they define that is very different. So we continue to work on that. So change continues to happen, and the needs are still there. Programs are growing. As you know, funding is changing. But we had a desperate need for rural hospice. When we just recently, I called 5 hospices in a rural area, small town Minnesota. They all said, we don't take peds. And I'm like, well, what do we do? What do you do if you have a dying child? We don't have anybody out there. Literally, we do not have anyone out there to take care of a dying child in some of these rural areas. And I've been doing this for 25 years. In 2000, we had the same problem. 25 years later, we're still in the same problem. We need to make some changes. So we're working on that. We looked at legislation. I mean, how are we going to legislate people to take a pediatric hospice patient? But if there's a way that we can work with the agencies and make sure that children get at least the same care as we give our adults, right? We don't send Brady home with no hospice support. Yet we're doing that for our children in this, not only in the state, across the state. I'm part of the coalition, a national coalition. Everybody's struggling with this problem. And it's worse since the growth of for-profit hospices. Not all for-profit hospices were like that, but it seems to have been correlated. So we continue to look at education and advocacy. So together we can do it. You know, I think I can, but I know I can. So thank you for listening, and happy to take any questions if you are.